What current thing will turn out to be a major health risk? Story 1. Chronic stress is so much more damaging than people realize. Carrying the weight of everything day after day absolutely destroys you. Any job that breaks you down so badly that you need therapy and medication just to function is not paying you enough, no matter what the salary is. I watch my mental, emotional, and physical health all fall apart, and eventually I hit my limit. I quit a month ago, and honestly, I'm pretty sure I'm dealing with undiagnosed PTSD now. Story 2. I am convinced my eyes are eventually going to give out from staring at screens all day, every day. And here's a wild little story. I've never seen so many kindergartners and young students wearing glasses. It's not because schools started testing more vision and hearing checks have been standard forever. Kids just spend too much time staring at close-up screens and not enough time outside letting their eyes focus on distant horizons. Studies are backing this up, and since COVID, the rate of childhood myopia has basically tripled. Story 3. Probably disposable vapes. They're full of strange chemicals, they're barely regulated, and people treat them like candy. Once long-term research comes out, I think the results will be ugly. I smoked cigarettes for most of my life, and I was proud when I quit by switching to vaping. I really believed it was the healthier option. And maybe in the short term, and in moderation, it is. But the problem is how easy it becomes to vape constantly. Cigarettes force you to stop what you're doing and take a break. Vapes don't. I ended up vaping all day long, and my breathing felt worse than it ever did with cigarettes. Long term, vaping is not good news. Story 4. Using plastic for everything. All our food comes wrapped in plastic. Half the objects we touch daily are plastic. Most of our clothes are literally plastic fibers, and we treat them as disposable. We buy new outfits every season and donate the old ones, which really means they're shipped overseas and dumped into the ocean or onto other countries' shores. Car tires constantly shed microscopic particles that accumulate along roads and get washed across the entire planet. Plastic fills landfills, seeps into water, embeds itself in plants, and now ends up inside our bodies and our organs, our bloodstreams, even our reproductive systems. We can't even study the true effects of microplastics properly because there are no plastic-free humans left to use as a control group. Plastic is going to be the next asbestos. Asbestos damaged lungs through tiny cuts and inflammation. Microplastics likely do the same, only the particles are even smaller and spread everywhere inside us. As a woodworker, I'm already seeing research showing how bad wood dust is, and microplastics behave similarly or worse. And what does society do? We keep producing more plastic products. Even green building materials are just different forms of plastic with a marketing spin, but hey, they use 20 less carbon during manufacturing, so supposedly that makes them environmentally friendly. It's insane. Story 5. I read a lot of digital science magazines, and lately articles keep popping up about arsenic, lead, mercury, and cadmium showing up in fruits and vegetables because the soil is contaminated. Combine that with the non-stop news about how we're all consuming microplastics, and it's honestly disturbing. The truth is, those toxic elements have always existed naturally in some places. Certain regions have had high exposure for centuries simply due to the local geology. Where I live, the groundwater has naturally high arsenic. That doesn't make it safe, but it also means people unknowingly lived with it long before chemistry tests existed. Plastic though, that's the real wild card. Nobody knows exactly what it's doing to us yet. The research is happening, but the answers aren't here. Story 6. Phone addiction is terrifying. Seeing teenagers wandering around town completely bent over their screens, not watching traffic at all, scares me as a driver. When I was younger, adults warned us that wearing a Walkman with headphones outside was dangerous because you couldn't hear cars well. But even then, we still looked up. We were aware of our surroundings. Now, kids are doing neither, not listening and not looking. Story 7. Right now, there's a measles outbreak in South Carolina with over 50 confirmed cases, including an employee at Greenville Spartanburg Airport, so probably that. It blows my mind because my father's side of the family lived through the era when these diseases were deadly and common. My oldest living uncle is a polio survivor. My dad's youngest sister died from measles before she was even a year old on the way to the hospital. My dad is number 9 out of 17 siblings. My uncle is number 2 and almost 80 years old. I am only one generation removed from that era, and I was vaccinated for both diseases. And now measles is making a comeback. It's unreal. Story 8. The government is gearing up to approve new pesticides that contain PFAS, forever chemicals, for American agriculture. It's another example of industry money steering policy. Children's health gets traded for lobbying dollars. The EPA even published a new webpage this month claiming it has a robust chemical-specific process for approving pesticides, even PFAS-based ones. Under pressure from pesticide companies, a public health strategy report was rewritten, shifting from focusing on pesticide harms to telling the EPA to reassure the public about its review procedures. And of course, the EPA's pesticide office is run by former pesticide industry lobbyists. Conflict of interest? Not in this era. Apparently, we've decided those no longer matter. Story 9. Loneliness. My girlfriend was away for 2 weeks, and during the first week and a half, I only spoke face to face with one person. I tried to make plans, but everyone happened to be busy. Near the end of the second week, a few friends finally came over for game night, and the next day, I felt like a different person. I assumed online interactions were enough to keep me socially grounded, but after nearly 2 weeks of isolation, I could feel something shifting mentally. It scared me a little. I truly feel for anyone who lives like that all the time. Story 10. The Department of Education quietly redefined what counts as a career, and fields like teaching, physical therapy, physician assistant roles, and nursing are no longer included. Starting in 2026, students in these programs won't qualify for federal loans. As early as next year, people might not be able to enter these careers at all because they simply can't afford the programs. I hope this is a wake-up call about what's happening in the US right now, because it's connected to rising authoritarianism. If you work in a woman-dominated field, or you're a woman, yourself, look into feminist economics, it explains a lot of what's unfolding. But more importantly, people need to organize and speak up. If you're not wealthy, white, straight, male, able-bodied, and born in the US to American-born parents, your basic rights are being chipped away. Story 11. SARS-2. It's like Pandora's box to chronic diseases, and everyone is pretending like it's just a cold. Nearly 500,000 peer-reviewed studies, and none of them indicate getting infected or reinfected is neutral or beneficial. We're just learning now that MS and lupus are likely triggered by EBV, which presents as a cold for most people, but for others, turns into mono. The acute phase of HIV presents like a bad cold or the flu. People didn't know the virus was disabling their immune systems 5 to 10 years after their infection. Just because you feel better after your illness, it doesn't mean your body wasn't wrecked by it. Lots of viruses have down the line harmful, even deadly effects. We know how to reduce transmission. The majority of currently circulating viruses are airborne. They can hang in poorly ventilated rooms for hours. Sanitizing your hands doesn't prevent you from inhaling airborne pathogens. Clean indoor air, ventilate, advocate for paid sick leave, and stay home if you're sick. Wear a well-fitted mask and let the science catch up. A healthy person has many wishes, a sick person only has one. Story 12. All the microplastics getting into us. This is just the beginning. Crap is gonna get much worse over time. Gonna mess so many folks up. Some will most likely pass away, etc. Lately, I've been thinking about this, and, believe it or not, the Fermi paradox. What if the solution to the Fermi paradox is civilizations that invent plastics like what we have right now inevitably destroy themselves because of micro and nanoplastics disrupting their body's ability to function properly? Story 13. The trend of sleeping as little as possible. I don't know how I messed up my algorithm like this, but I am always seeing ads for those apps that claim to tell you that the perfect time for you to go to sleep is at 2:23 in the morning. And then what? You go about your day on 5 hours of sleep. Yeah, I am starting to get stressed by this one. I just started really paying attention to my sleep this week as I got the newer than my old one, Apple Watch that tracks sleep data. I always knew I didn't sleep well, but it really opened my eyes how poorly I slept. Apparently I cannot sleep more than 5.5 hours, regardless of what time I go to bed, sleep earlier, and I still wake up in the dark 5.5 hours later. It's freaking me out, and I have no idea how to fix it. And no, it's not because I have to go to the bathroom. Story 14, social media. It's making us isolated while engaged, knowledgeable while being close-minded, creates so much envy and stress while also allowing the venting of stress. It's great because we can talk to people all over the world, but at the same time it tends to create echo chambers and conflict. It reduces physical activity and creates procrastination. I don't know, both are right and wrong, because they both imply it's correct. The problem being that once false information is out, it is always out there. Take that DoorDasher. Still see people saying, the guy left his door open even though the police have stated his camera showed her opening the closed door. Because some people have the original story in their memory, they might always defend the DoorDasher. So it'll lean towards being informed, because you can be misinformed. Knowledge does tend to be more on the correct data only. Story 15. The fact that MDROs, multi-drug resistant organisms, are now present in large population groups. India and other countries sell antibiotics over the counter with no prescription. People use them for the wrong things. They use them a lot and often don't take the full course of antibiotics. That means regular antibiotics won't work for them. It will become more common that even combinations of antibiotics given intravenously will not work, which means that you die of infection. We used to see this just in hospitals through patient and caregiver contact. That has changed. The Lancet recently reported that 83% of East Indian nationals already have MDROs. It may be the same in the other countries that treat antibiotics in the same way. MDROs are contagious. You can get them by touching the carrier, touching something they touched, bodily fluids, and via particles in the air, sneezing. I see nothing about this in the news. People are still traveling. It already is a major health crisis. Story 16. This list here is already known. Health risks. Chronic stress is a known cancer risk. Phone or social media has a known self-destruction and stress increase. This one has a big asterisk due to use variants. Vapes and aerosolizers are known to not be controlled in many countries, and many of the contents are carcinogenic and vaporized. Meat is a type 1 carcinogen already and a leading cause of cardiovascular disease. Dairy joins the cardiovascular risk, and carcinogen status is increasingly likely in the WHO International Agency for Research on Cancer. There is also the phosphate leaching mechanism, heavy metal poisoning due to pollution and lack of regulation enforcement, and historical pollution, methane, and the increase in asthma and lung cancers. Antibiotic resistance due to overuse of antibiotics, mostly in animal agriculture. People not following prescriptions are a small problem here as well. Nitrogen and manure runoff from animal ag. It's increasingly getting into groundwater and waterways. We're seeing disease and cancer increases. The nitrogen is causing algae blooms and ending or poisoning coastal and freshwater marine environments. Climate change for heat and cold spikes, changes to humidity, etc. Story 17. Obesity. Half of the global population is overweight by now, with 1 billion being obese. The related health issues will cost billions of people years of their lives and quality of life. The accelerated wear of joints and the reduction of mobility at a rather young age, making the issue worse. The highly increased risk of illnesses such as diabetes, cardiovascular diseases are just a few issues here. And for some reason we are stuck at discussing this on the level of aesthetics and trying not to hurt anyone's feelings, while junk food corporations bathe in their profits. Story 18. I have a feeling that vitamins and supplements are going to be a problem in the future. In the US, they are unregulated, and so many people take fistfuls of supplements telling them they'll be thinner, healthier, happier, less bald, less acne, less wrinkles, firmer and softer skin, bigger muscles, etc. People are taking these in earnest, hoping to optimize themselves, but to look to bridge any vitamin deficiencies through their diet, or to see which deficiencies they have, if any. You have celebrities and snake oil salesmen shilling their supplements with no care of the long-term effects, consistency in ingredients, and product safety. That is high levels of lead from sourcing cheap and unclean ingredients. I think we'll see the impact of toxic ingredients and overdoing of vitamins or supplements on our organs in the near future. Story 19. The decisions currently being made by our politicians. Rollbacks on SSI, SSDI, as well as ADA and ACA protections and food stamps, the change in classifying professional degrees, the concerted effort to undermine and dismantle our public school system, the DEI witch hunt, the list goes on and on. This administration is playing survival of the fittest and leaving disabled and poor people out to dry. It's sickening. If you're not wealthy or at least healthy and earning good wages relative to your cost of living, you're going to have a bad time. People will die. Story 20. Keratin treatments that are being done in salons. All the stylists and clients are breathing the toxic crap they are off-gassing. It's in the air even if it's not getting done on your hair. It's in the air even if it's not being done in your chair. Formalin, glyoxylic acid, propylene glycol, and methylene glycol, to name just a few of the chemicals, all heated up via flat iron and off-gassing into the air, with the heat converting it into formaldehyde. Usually it's done without any knowledge or heads up to other stylists and their clients of those services being performed on other clients in the salon. There are typically no abilities to avoid or even consent to breathing it as clients if a stylist decides to perform that service on someone. Story 21. Everyone's listing things we already know are major health risks. IDD have to be something that people perceive as totally fine or irrelevant right now, or even think is healthy. Maybe more research into protein powder. It's highly processed, which generally negatively impacts human health. We already know there are some issues, as in it's more rapidly absorbed, so it can have some negative effects in terms of metabolism, but it might come out as highly carcinogenic or something we don't know. Maybe electric vehicles pose a severely increased chance of some health issue. Eventually, they're going to figure out how to get people to live to be 160 years old, and people are going to look back on us like we were in the dark ages with our lifespans and how we lived. Essential oils. Maybe essential oils are giving everyone cancer, lol. Or, I don't know, cotton. Story 22. Basic understanding of what causes tooth decay, because it's 100% preventable. So many people have no clue, or don't find out until they are adults. Sort of. Tooth decay is caused by the lactic acid made by bacteria that eat sugars, that soften your enamel, and then you brush that enamel away. Later when you brush your teeth, it's possible to alter your mouth's bacterial flora so as to avoid softening enamel, and exposing your enamel to fluoride can strengthen your enamel against lactic acid, but that's pretty cutting edge right now. The best way, before you brush your teeth, sip water or chew gum to get that lactic acid out of your saliva. Then brush your teeth a half hour later. Story 23. Please wear a respirator when sawing or carving anything. There was an article a month or two ago about a woman who made a living carving shells for art, and she developed lung cancer from the tiny particles she inhaled. Bone will also do it, though I can't remember if wood will or not. Also, when working with chemicals, be safe, y'all. That article was wild. If I remember correctly, it was the pollutants from the oyster shells that got her sick because they act as filters for the water, and the area she got them from was extremely polluted. Even when doing any deep cleaning, I try to have something over my face. Better safe than sorry. Story 24. Fume events on planes. They're a lot more common than you think. The average person isn't at a great level of risk, but frequent flyers and pilots and flight attendants are. multiple aviation workers have died, and hundreds are sick from health complications due to fume events. The airline industry covers it up left and right. Threats, erasing logs, paying off doctors to say people are fine, just paying off people in general. You name it, there's not a lot of info on it because of how well it's covered up. I only know all of this because it happened to someone in my family, and a lot of people in my family have been or are pilots. Story 25. Getting x-rays more often than reasonable doesn't just increase infertility risk, it increases your risk of cancer as well. The amount of people who stand within 6/5 of the x-ray tube without a lead shield and say, "It's okay, I am done using those parts anyway," just boggles my mind. Getting a CT head scan, or about 34 x-rays, rough equivalent, in your lifetime increases your cancer risk by 0.5%. There are people who've had upwards of 25 CT scans and 75 x-ray exam series in under 3 years, just at one facility, likely got even more elsewhere, who have potentially never been told about this. Now, if you've got a broken bone, then you're going to probably need an x-ray so that they can see how to repair it properly. And you are always better off getting your x-ray or CT scan taken when your doctor recommends it. Just be aware of the risks. No luck finding the source article for the above statistics, but this article from Harvard opens with a brief explanation of the risk followed by a dosage chart. The estimates above are approximate based on average radiation dosage and can vary with factors like body habitus, size, and the area or anatomy being imaged. If you find any conflicting information, please comment below. Always trust your medical professionals over something you read from strangers on the internet. Story 26. The lax nature of how people treat information and data security. All it will take is that one event that shakes the world and the entire landscape of the online world. I'm no security expert, individual data leaks aren't going to change anything. People treat them more as a nuisance. If you really want a Black Mirror style prophecy, it has to be something that affects the general populace en masse. What happens when your own data could count against you? A digital copy of your existence that doesn't even belong to you. I'd call it a joke if the social credit system didn't already exist. Story 27. Chiropractors. Another story of my mom and chiropractors. It was suspected I had scoliosis as a child, and my mom was supposed to take me to specialists to get it checked out. She instead took me to a chiropractor who told her I should not see a doctor. I was only 12, so I didn't know I was supposed to see a real doctor. I thought the chiro was the doctor. I got lucky, and my scoliosis stayed mild, but by never seeing a doctor, I was put in extreme risk of being crippled later in life. Story 28. Social media. The instant gratification and dopamine release from social media has been shown to affect heavy social media users in the same way addictions such as alcohol, cigarettes, and drugs affect people. Back in the beginning of YouTube, most of the people I followed made videos when they felt like it, once a week, or even less than that. Now the standard seems to be around 3 uploads a week to stay relevant. People expect high quality, regular content. With Twitch and other live streaming platforms, people are now expecting fresh, live content at any time of the day and night, and constant feedback and interaction with content creators on Twitter or even Discord. Then it was the Vines wave, and now it's TikTok. Story 29. Vaping still hasn't had tests run on its effects because of how new it is, but it still is harmful, just not as bad as cigarettes. If I remember correctly, the main ingredient of vape fluid is some kind of glycerin. Isn't one of the worst parts of smoking cigarettes, beyond the addictive quality of nicotine, the tar? It may be that replacing one lung coating product with another isn't all that great for us. I hope that it is harmless though. I much prefer the smell of tutti frutti vape fluid than cigarettes, although the smell of cigarettes does make me miss smoking a lot. Story 30. It feels like everything artificial ends up being tied to some kind of health risk. Recently, black plastic cookware was linked to several harmful issues, and I genuinely like using mine. Even everyday items like pillows can be questionable. Honestly, my instinct has always been that anything with an unnatural smell is probably bad, mostly because my throat instantly reacts to things like Lysol, candles, cologne, and perfume. One day, I finally researched it, and sure enough, most of those substances are pretty harmful. But I already suspected it because my throat would burn and my sinuses would swell every time I was around them. Story 31. According to the WHO, the global climate crisis has enormous health consequences. Air pollution alone kills around 7 million people each year. More than a quarter of deaths from chronic respiratory conditions, heart attacks, strokes, and lung cancer are caused by the same emissions driving climate change. On top of that, rising temperatures worsen malnutrition and help spread infectious diseases. The WHO says it's developing policy guidance to help governments reduce the health risks associated with air pollution. They emphasize that leaders in both public and private sectors must work together to clean the air and reduce the health impacts of climate change. Story 32. The WHO says there are huge gaps in health outcomes between socioeconomic groups. There can be an 18-year difference in life expectancy between people in low-income and high-income countries, and even within the same nation or city, people's health prospects vary dramatically. Low and middle-income countries also face a heavier burden of cancer, diabetes, and other chronic diseases, which can overwhelm families financially. To fight these inequities, WHO is focusing on improving maternal and child care, nutrition, gender equality, mental health, and access to clean water and sanitation. They're also guiding countries on how to close these healthcare gaps. Story 33. Nearly 1/3 of the global disease burden is linked to poor nutrition, unsafe food, or unhealthy diets, according to the WHO. While hunger and food insecurity still affect millions, there's also a rapid rise in diets high in sugar and fat, leading to spikes in obesity and diet-related illnesses. On top of that, tobacco and e-cigarette use continues to increase in many countries. The WHO says it is helping governments create evidence-based policies, investments, and reforms to improve food systems and promote healthier diets. They're also working to strengthen global tobacco control efforts through political commitment and better implementation. Story 34. The WHO warns that misinformation combined with declining trust in public institutions is increasingly influencing people's health decisions. When people trust their health systems, they're more likely to follow medical advice and seek care when they need it. To rebuild trust, WHO is helping countries strengthen primary care systems and combat misinformation on social media. They also say scientists and public health professionals need to listen more closely to the communities they serve. Better, more reliable public health data systems will also be essential moving forward. Story 35. There's a worldwide shortage of healthcare workers due to poor pay and years of underinvestment in training and hiring, according to WHO. These shortages threaten the stability of health systems and put essential care services at risk. By 2030, the world will need 18 million additional workers, including 9 million nurses and midwives. To address this, the World Health Assembly declared 2020 the year of the nurse and the midwife to push for greater investment in education, skills, and job opportunities. The WHO is also working with countries to secure funding so healthcare workers can be trained properly and paid fair wages.